Thanks, Dan. Acid reflux is no fun. Joining us now is Dr. Erik Raborn to talk about when you should see a doctor. So that actually perfectly leads into my first question, which is when should you see a doctor if you're concerned about acid reflux?
So that's a perfect question. So, the big things for acid reflux are, you go to a work function, you go to the potluck, you eat something you shouldn't, you have a bit of acid reflux for one day, and then it doesn't happen again for a month or two afterwards. Absolutely no big deal. If you're having acid reflux or burning deep down in your stomach 2 to 3 nights a week, that's a problem that requires further evaluation and potentially medications.
Yeah, and how should people who maybe are having it once in a while, sort of rectify that at home?
Absolutely. The big things are throwing a couple extra pillows underneath your sleeping position to try and angle yourself up a little bit, and do not have anything to eat 4 hours before you go to lie down for bed. And then figuring out what your trigger foods are can also be very helpful.
Yeah, what are some trigger foods that might be common?
Sure, the classic ones are coffee, chocolate, the best things in life.
Yeah.
And then a lot of citrus and like traditionally spicy things can be trigger foods for a lot of people.
Okay, interesting. And are there any other symptoms that might come along with the uncontrollable acid reflux that people should worry about?
The ones that I really worry about are when you're having issues with swallowing, either pain with swallowing or things just aren't traveling the way they're supposed to. If you're having a lot of hoarseness or you feel changes in your voice, if you're having frequent pneumonias or sinus infections that we can't really explain, and especially if you're having weight loss or if you have a family history of esophagus or stomach cancer, it really requires further evaluation.
And if people are looking to talk to their doctor, where can they find some additional resources?
Sure. So you can go to rcgastro.com. That's the website that my colleagues and I run that answer a lot of these questions. And it also includes information on there. If you want to get scheduled in the GI clinic, you can call us at 342-3280. And then, as always, for people that just want to go directly to colonoscopies for screening, which I understand is a separate issue, but we don't need referrals. You can just call us at 721-5400 and get scheduled without a referral.
All right, well, thank you so much for joining me here on Good Morning Code of Territory. We'll be right back after a quick break.